Welcome to animatedteeth.com and our page that outlines the steps of making a dental crown for a tooth. In this video, which is part 2 of our series that explains what the crowning procedure is like for the patient, we cover some details related to trimming and shaping your tooth. As the patient, you'll probably find that the process of trimming your tooth down for your crown, referred to as doing a crown prep, which is short for crown preparation, is pretty similar to the drilling you've experienced when having fillings placed, although, with a crown prep there's more of it. As you sit for your procedure, expect to feel the vibrations of the drill as it works against your tooth. And you'll notice the voluminous amount of mist the drill creates as it runs, which will tend to accumulate as a pool of water in your mouth. This spray output is important because it dissipates the heat created by the friction of the drill as it works. That's important because the nerve tissue inside your tooth can be harmed by this heat, which would lead to a need for root canal treatment. Of course, if your tooth has already had root canal therapy, that wouldn't be a concern. But the odor of a singed tooth is pretty foul, so keeping things cool avoids that too. Throughout the trimming process, your dentist's assistant will use their suction device to catch as much of the drill's spray as possible. And they'll periodically wash off and dry your tooth so your dentist can evaluate their progress. They'll also suction accumulated water out of your mouth to keep you comfortable. As your drilling process continues, there's a chance that you may find that the anesthetic you've been given hasn't been totally effective. As mentioned in our first video, don't confuse feeling temperature variations or pressure with pain, because these are separate sensations. But no doubt, whatever you do notice, you'll want your dentist to evaluate. So, as also mentioned in our first video, if you've set up a hand signal with your dentist beforehand that indicates you need them to stop so an issue can be addressed, like you've started to feel pain or even just need to swallow, having that signal already arranged will be useful in these kinds of situations. We'll also mention that if getting tired keeping your mouth open is your issue, ask your dentist for a bite block. This is a rubber device that is placed between your teeth on the opposite side to prop your mouth open so you don't have to struggle to stay open. Different than with a filling, during a crown prep all sides of your tooth must be reduced. So expect your trimming process to go on comparatively longer, maybe for a total of 15 to 20 minutes or so. The amount of reduction needed on each side of your tooth is usually around 2 millimeters, which is about 1/16 of an inch. As a guide, a dentist will often place a drill bit, termed a dental burr, in their drill whose diameter is the same amount. They'll then use it to cut vertical grooves into the surface of your tooth. These are referred to as depth cuts and they're used as a guide when preparing your tooth. Using their drill, the dentist will trim down the sides of your tooth until all evidence of the depth cuts has been removed, which means the needed 2 millimeters of tooth reduction has been accomplished. Your dentist may make depth cuts on the chewing surface or biting edge of your tooth for the same reason. Or they may just gauge the amount of clearance they've created by having you close your teeth together and visualizing it. If they're working in a location where they can't see so well, like on a back tooth, they may place a piece of wax on your tooth and have you bite into it. Its resulting thickness will reveal the amount of clearance that's been made. Every step of the crowning process is equally important in influencing the outcome of your case. So, expect that while preparing your tooth your dentist will tend to obsess over the shape their work has created, especially down around the gum line where the edge of your crown will lie. They're just trying to get everything as perfect as possible, and they know this is their only chance to do that. Once they've finished prepping your tooth, they'll then make plans for taking its impression. We cover that step in our next video. Goodbye.